back to Great Day. If you get a positive diagnosis for breast cancer, what's next and where? At Genesis Medical Group, you can get your mammogram, genetic testing, meet with oncologists, and get a personalized treatment plan all under one roof. Dr. David Ellett is an oncologist, and he's also involved in research looking for the best therapies. He shared how Genesis Medical Group makes quality care convenient and comforting, actually, for the entire family. Dr. Ellett, I'm going to start off with you explaining what Genesis Medical Group is, because it's an innovative way of doing medicine. It's not a hospital, but it's not necessarily individual doctors as well.
Yes, Genesis Medical Group, think of it as a family. You need your mom, you need your dad, you need your sisters and brothers. So Genesis Medical Group is, we have primary care doctors, we have specialists, we have ability to do radiation therapy, infusion, pharmacy. Essentially, we are protectors. Yeah. We are protectors around our patients to make sure that everything is done under one roof.
You take care of the entire family. You can have, pediatricians to take care of the kids. You have even up to geriatric medicine as well. And of course, women and men, the whole bit. You take care of everybody. You are an oncologist. What made you decide to go into oncology?
Oncology is fascinating. As we get older, there is more and more chances of us getting some kind of complication which involves cancer. And I strongly suspect oncology could be the key to our future, even to immortality in a way. Yeah. But more importantly, I guess it's a calling. That field provides such intellectual ability, and you have to be always on your toes.
Yeah. It's interesting. With breast cancer, at one time it was kind of like a death sentence. Today, thousands of people are still dying, but that's not because the therapies aren't there. It's because they find out about it in the later stages. So let's start with the very first thing we can do is make sure that we get our mammograms.
Absolutely. And we see the trend. We do see it, women getting it early. Men can get it too.
Yeah.
And there's
an important point you make there. If breast cancer is prevalent in your family, even as a man, don't dismiss that.
Absolutely. Especially we have mutations like BRCA mutations where men, they can get it. Women, if you feel a mass, get it tested.
Yeah.
If there is a dimpling in the skin, somebody has to look at it, or the abnormal discharge. There is a lot of things that we want to make sure we don't ignore.
Yeah.
Sometimes it's easy to ignore. Please don't. It's very, very important.
Yeah. There's several stages of breast cancer. There's one that kind of confuses people, and it's called stage 0. What does stage 0 mean? Because a lot of people think, oh, 0 means I don't have anything to worry about.
So 0, so think of the ducts, is basically you have a ducts, and outside the ducts there is a lining. What it means, stage 0, that cancer did not penetrate the membrane yet. So it's, for example, it's called ductal carcinoma in situ, where it's inside the duct, yet it didn't penetrate through. It's very localized cancer, usually would require just a surgery and then hormonal therapy for the next 5 years as a preventive tool. But it's curable.
Yeah. You mentioned earlier, if you feel a lump, go in. Usually when we feel a lump, then there's something's been going on for a while, which is the reason why we want to go as early as we can. So early stages of breast cancer, usually there's no symptoms, right?
Yes, and sometimes we do find, we sometimes find lymph nodes, or we find in this quadrant on either side. Yes, there could be no symptoms. Yeah. That's why we have to be so cautious. That's why we need to do mammograms, because we can pick it up early before the significant lump will appear.
Yeah. The nice thing about Genesis Medical Group, if you find a lump or something, you can have that tested, you can figure out if it's cancer or not, and then you can go through the process with that patient.
Yes, absolutely. And the process involves the whole team. It involves oncologists, somebody like me, it involves surgeon, it involves radiation oncologist. The decision is not made by one single doctor. The decision is made by a team. More importantly, Genesis Medical Group prides itself by the fact that we follow the guidelines in written blood. Everything we do has to be based on guidelines, based on the scientific research. So that way we have to make sure that we provide the best care possible.
Yeah, and with that care, we know that chemotherapy and radiation are two of the things that we oftentimes hear about, but there have been advancements made, and so you treat the patient as an individual because there are different things that might be done for different people.
Absolutely. Breast cancer is magnitude of different cancers. It's all based on whatever hormonal status. You hear estrogen receptor positive, progesterone receptor positive, or HER2 positive. It's all treated differently. And we have to be very careful to look at the, what hormonal status it is, what genetic makeup of the cancer is, what BRCA mutation is, to pick the drugs. And the drugs, again, it's all based on guidelines. Nowadays, we have to genetically test almost every single cancer just to make sure that we're doing the right thing.
Yeah, all right. Well, thank you for doing the right thing, because I know a lot of patients who have gone through Genesis Medical Group who can now say, I beat cancer. So thank you very much. Genesis Medical Group is seeing patients of all ages, kids, parents, grandparents, and great-grands. Remember, they can handle seniors with extra care as well. To book your appointment, the number to call is 281-440-5300. Again, that's 281-440-5300. For more information, visit their website, genesisdoctors.com, genesisdoctors.com. And remember, all of your medical records can remain under one roof, and doctors can talk to each other about your entire family's care.